If you're getting ready to go on Medicare or looking into the possibility of going on Medicare, there's a ton of information out there. In this video, I'm going to show you everything you need to know to make the right decisions. Now, the first crucial decision you have to make is when should you start Medicare? So let's talk about that. Now, we are usually eligible for Medicare at 65, but do you have to start at 65? Not necessarily. Now, there are some people who must start Medicare at 65. There are some people who might want to start Medicare at 65, and there are some people that absolutely should not start Medicare at 65. So let's talk about those of you who must start at 65. And first off, this is anyone who is not working, meaning they don't have an employer plan available of theirs or their spouses. Okay, so no active employment, no insurance options there. You are going to need to start your Medicare at 65. Now, you may be covered by a retiree plan. That retiree plan sometimes takes you to 65, sometimes beyond. But regardless, you have to start Medicare at 65 because even if you keep that retiree plan, it only pays second to Medicare. The same is true if you have COBRA insurance. Sometimes we keep COBRA for a short period of time, but regardless, if you're on COBRA, when you hit 65, you got to be enrolled in Medicare A and B because COBRA will no longer pay first. It only pays second to Medicare. If you have an Affordable Care Act plan, ACA plan, the Healthcare Exchange, you went there to get that individual plan. Technically, you can actually keep an ACA plan beyond 65, but the problem is the tax subsidies go away, all the cost sharing goes away, you pay full premium, you pay full deductible, so there's no reason to keep an ACA plan once you're 65. Fourth group of people who must go on, and that would be those of you that are retired from the military. You served our country for 20, 25, 30 years. You have TRICARE insurance. And what happens with TRICARE, it pays first until you hit 65. After that, it only pays second. So you have to enroll in a Medicare A and B to get TRICARE insurance to be in the second payer position. The last group, and this is a little bit more confusing, and that's anyone who is still working and has a group plan, you or your spouses, that you're covered by, but that employer has 19 employees or less. In that scenario, you have to go on Medicare because that company plan, that group plan, no longer has to pay first in a small group situation. 19 or less, they're going to pay second. Medicare would pay first. All right, so you have to. Now, who might want to, that's anyone that is still working or their spouse is, and they're covered by a group plan that has 20 employees or more. Now, you don't have to do anything with Medicare at all, okay, but you may want to, and we suggest what you want to do is you want to compare. What does that group plan look like? What's the premium? What's the deductible? Do you ever meet that? Co-insurance. What's the annual max out of pocket? If you got cancer, would it cost you $10,000, $15,000 for the year? And what are your medications? How are those covered? So we look at all the aspects of the group plan and we compare that to our Medicare option. Sometimes Medicare makes financial sense. It's a better coverage at a better cost, and then get off the group plan and go on Medicare. Now, not always, and we're happy to advise on this, and we'll always be honest with you about what we would do if we were in your situation. But my point is, you want to compare those two options and go on Medicare if it makes sense. Now, for those of you who I say should not go on, that would be anyone that's covered by a group plan, you or your spouses, 20 employees in the company or more. I would recommend not going on Medicare if somebody else on that group plan in your family is covered, meaning a spouse that's younger that has no other insurance options, or children that are covered age 26 that have no other insurance options. You wouldn't want to go on Medicare because if you do that, then it's going to affect them adversely. They're going to lose their insurance as well. So again, we would never go on Medicare if someone is going to be hurt by that decision. All right? So there are some of you that must, and now you know who you are, those who might. And again, this would be those of you who are in a 20 employees or more plan, and others in your family are covered by that insurance. Wouldn't want to hurt them at all. All right, so when to start Medicare, that's at 65. Now, I want to clarify something. If you have to start at 65, you actually have what is called an initial enrollment period. And this initial enrollment period lasts 7 months. And so if you have to start at 65 and you have to self-enroll, you have 7 months and only 7 months to do it. So the way that works, let's just say my birthday is 7/15/1958. And that means I qualify for Medicare A and B July 1, 2023. And I have to self-enroll. I have 3 months before that, my birth month, and 3 months after. So this would be 6, this would be 5, this would be 4, this would be 8 and 9 and 10. And so if I enroll these first 3 months before my birth month, my Medicare coverage starts July 1. But if I enroll my birth month, they start me in August. You enroll in August, they start you in September. Enroll in September, they'll start you in October. And the last month you could roll, the 7th month, they would start you then in November. So your coverage is being delayed a month if you put your enrollment off during this period of time. So you understand, I have 7 months to enroll. And when I enroll determines when I'm going to start my coverage. Now keep this in mind. If you are already on Social Security or you're already receiving Railroad Retirement Board benefits, you will be automatically enrolled into Medicare. Nothing you have to do. Self-enrollers, you have 7 months to do it. But those that are on Social Security, they're going to mail you your Medicare card. You're automatically enrolled. The A and B card is going to show up. It's going to show up, and this is my example right here in March. It comes 1 month prior to this 7-month window. So your card will show up in the mail in this scenario in March. All right. And so that's for those of you that have to start at 65, self-enrollers. This is the time period you must do it to start your coverage on time. Now, those of you that are going to stay on a group plan, let's talk about those over here. And you're not going to start at 65. You're going to start after 65. You're not going to use the initial enrollment period. You're going to use what is called a special enrollment period. And there's 2 additional forms that we do with this one. What we have to do is we have an L564 and a CMS 40B. And basically what's happening, let's just say we work till we're age 67. What we have to do is we have to prove to the government that you have had credible insurance and active employment back to age 65. It could be yours, it could be your spouse's, doesn't matter. But we have to go back to 65, and the L564 form is given to your HR department, and they'll fill that out, and they'll complete that, give it back to you. And then the 40B form is the form we use to tell them when you want to start your coverage. So if my group plan ends June 30th, I want to start my Medicare July 1. On the 40B form, I will let them know, please begin my Medicare July 1. So I'm picking the date. And we turn this paperwork in anywhere from about 60 to 90 days prior to when you're going to lose that group plan and retire. Alrighty? And so these 2 forms are not necessary when we come in during the initial enrollment period. We can do all this online. Over here, we're going to have these paper forms that will be submitted to the local Social Security office to start your Medicare. All right? And so the point is this, depending upon when you come in, will determine what enrollment period we're going to use. At 65, initial. After 65, we use the special enrollment period. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now, the second crucial decision is what's going to cost you to be on Medicare. Now, for most people, Medicare Part A is going to be 0 premium. The reason for that is because we pay into Medicare taxes all of our life. Right now, 1.45% of every dollar we make goes into Medicare. Our employer matches it. If you're self-employed, you pay the full 2.90%. So we're funding Medicare. So Medicare says they will give us Part A at 0 premium. Now, Part B is going to have a premium. Part B right now is $164.90 for, this is a month by the way, and for about 93% of the population, because this Part B is based upon income. All right, and so the income they look at is your modified adjusted gross income. So if someone's going to start Medicare in 2023, they're looking back at your 2021 tax return. If you're going to be on 2024, they look back at 2022. So they change this every year. But it is the modified adjusted gross income that determines how much we pay for our Part B premium. That is your adjusted gross income, line 11, typically on the 1040, plus tax-exempt interest. You have to report that usually on line 2A or 2B, and it's there on your tax return. They add the 2 together, and that number determines your Part B premium. And so what we have is we have different income thresholds. And so the way this works, if you're a single filer, if you make $97,000 or less, modified adjusted gross income, you would pay the $164.90 a month for your Part B. If you're a married filing a joint return, $194,000 or less, modified adjusted gross 2 years prior, then again, each of you would pay $164.90. Now, 7% of the population is actually above these thresholds. And when you are, what's going to happen, they're going to add to your Part B as well as to your Part D. And what they're adding are surcharges, officially called IRMAs. IRMA, and that's an acronym that stands for Income-Related Monthly Adjusted Amount. Again, only 7% of the population has IRMAs, but these are additional amounts added. And those are going to vary because there's 5 different income levels. They're going to vary anywhere from about $80 a month upwards to about $450 a month if you make $750,000 or more. And so we can see our premiums rise because of these income amounts, all right? And so that is one of the costs of Medicare. A is free, B has a premium. Now, there's other costs beyond Medicare. I'll teach you those on the next slide as we look at insurance options. So once we made the decision to be enrolled in A and B, we really only have 3 options for using our Medicare coverage. One of those options is to stay in A and B only, meaning nothing else beyond A and B. That's the cheapest option, by the way, the most risky as well. And then we have the option to do A and B, and we get a supplemental plan to fill in the gaps that Medicare didn't cover, or we can do a C plan, which are also called replacement plans, or also called Advantage plans. All right, so those are 3 insurance options that you have to decide. Now, let's talk about how these work and the kind of the downsides, the positive and negatives of each of these. So if a person has A and B only, again, this is the cheapest option on a monthly basis because A is free for most people, B is a premium, what? $164.90. So that's the only premium involved. But the problem is, other than preventive services, if you have A and B only, Medicare is not going to pay any bill 100% other than preventive. And so you're always going to have a balance of any service that you get. We call those gaps in your coverage. So the A of Medicare is your inpatient side, and the B of Medicare is your outpatient side, as well as all doctor services, whether that's outpatient or at the hospital. All the doctors are paid through Medicare B. So what we have is we have 3 gaps on the A and we have 3 gaps on the B. I'm going to just highlight those real quickly. On the A, we have a deductible, which means you go to the hospital, it's going to cost you $1,600. If you're in the hospital for an extended period of time, which is month 3, month 4, and month 5, they charge you daily copays, $400 a day, month 3, $800 a day, month 4 and month 5. Again, those don't happen often, but when they happen, they're very expensive. Last time item that's covered under Medicare A is a skilled nursing facility. This is after a stroke or a hip replacement, intensive physical therapy, rehab. And so what happens, Medicare says first 20 days doesn't cost you anything as long as you're in the hospital 3 days prior, 72 hours or more. Go to skilled nursing, no cost to you, but days 21 to days 100 will cost you $200 a day copay. So those are the gaps on the A. On the B side of Medicare, we also have a deductible. It's once a year. It's $226 for the whole year. This A deductible could happen multiple times in the year, but the B deductible is once a year. After that, Medicare is going to be an 80-20 plan. Your part is 20%. Medicare pays 80% of the bills on the B side. You pay 20%. And the last item is called excess. Now, this does not happen often, but this is when a doctor legally can add 15% to the bill. So this is a doctor that sees Medicare patients, but will not take Medicare reimbursement rates as payment in full. It's called assignment doctor. And a doctor that doesn't do that can legally add 15%, and when it happens, you got to pay for it. And so here's my whole point. These are the gaps that exist in Medicare, 3 on the A and 3 on the B. So if I have Medicare A and B only, what happens? I'm responsible for all those gaps, and it never stops. Now, if you're healthy and have no problems, that's not a problem. But you have some kind of a serious illness, this is what puts people into bankruptcy and really can cause them a great grief financially. So again, very cheap, but also very risky. Most people won't do that. So what many people will do when they decide to stay in A and B only, they'll get a supplemental plan. Okay, in other words, they are enrolled in A and B, but they don't like the gaps, so they get a supplemental plan to fill the gaps in. So we go to a private health insurance company and we take the gaps and we pay them a premium, and they're going to take all the gaps or some of the gaps for us. So one of the plans that is a full coverage plan called the EP plan covers 6 of 6 gaps. Truly, if Medicare pays, you should never get a bill because that plan pays for all the gaps. The problem with that plan is that many people can't buy it today. They're phasing them out. Anyone born before January 1st, 1955, that's the key. Got to be born before January 1st, 1955, which means you started Medicare prior to January 1, 2020, or were eligible. You can buy an app plan, keep an app plan. Millions of people have them. They don't lose them, okay? They're grandfathered in. But anyone born after January 1st, 55 cannot get an F plan, so that takes the most popular plan today then is the G plan. And the difference between F and G, premium is going to be lower, and what will happen is it covers 5 of the 6 gaps. The gap it doesn't cover is the once a year B deductible. After that small B deductible is met once a year, then it's a full coverage plan, just like the F plan. But you would be out of pocket here. Again, premium's lower. Next plan below, that's called an N plan. It covers 4 of the 6 gaps. It doesn't cover the B deductible. Remember, F's the only one that does that. G doesn't, and N doesn't. Also, N will not cover excess charge if and when that happens. And again, about 1 out of 10 doctors right now will pay excess. That could change in the future. I will tell you that most cancer hospitals always charge excess. A lot of specialists are. But the point is, if you have an N plan, you'd be out of pocket on that. In addition to that, every time you went to a doctor, they could charge you up to a $20 copay. Go to the emergency room, you got a $50 copay for that. So again, premium is going to be a little bit lower, and you're just taking on a little bit more risk. There is no right or wrong. Here, of course, that's dependent upon your birthday, but between these two, you just have to decide what you're most comfortable with and how much risk that you would like to assume. So that's an option, A and B. Get a supplemental plan. You're paying a premium for those supplemental plans because you're transferring the risk of these gaps, all of them or some of them, to that insurance company, just like we would auto insurance or homeowners insurance. We transfer liability. We got to pay a premium, and they take those gaps from us. The last option we have is doing a replacement plan called a C plan. Now, with C plans, what's happening here is you have a private health insurance company that's actually replacing A and B for you. Medicare's not going to pay any bills for you like they would in these two scenarios. Over here, they give a flat dollar amount, usually $1,000 a month, to the Advantage company, and they're now responsible for you. It's called a replacement plan. So here's the way these work. Number one, these plans typically have 0 premium. Now, we had to be enrolled in A and B, remember that? So we got to pay our B premium, $164.90, but the insurance company usually doesn't charge you a premium. And why is that? Well, because instead of paying a premium, what you're going to do is you pay as you go. All right? And so what that means is you have copays. You may have a deductible. You may have coinsurance. And again, they'll give you the schedule of your out-of-pocket expenses. And again, they're very reasonable, but it's a pay-as-you-go system. So if you go to your primary care doctor, usually a 0 copay. Specialist, $25 to $50 to see a specialist. You have an MRI or a CAT scan, maybe $200, $250 per scan. You have an outpatient procedure, cataract surgery, knee replacement, probably $300 copay. Go to the hospital, $350 a day copay, up to days 1 to 6 or 1 to 7. But you can see it's pay as you go. Now, a lot of people, you're accustomed to paying as you go, and not too bad of a deal whenever you're 30, 40, maybe 50. But once you get Medicare eligibility and beyond, you may not like so much pay as you go system, but that's the way these systems are designed. Secondly, when we have an Advantage plan, we also have networks. And that means you're going to have an HMO plan or you're going to have a PPO plan. When you enroll with a supplemental plan, you don't have a network. You can go anywhere that takes Medicare. Over here, same thing. Anyone that takes Medicare, go where you want. Over here, you probably try to go to someone that's going to take the plan because your prices are going to be lower. On an HMO, you can't go out of the network. PPOs, you can, but it costs you a tremendous amount of more money to do so. But we have networks, so that's how they differ over here. In addition to that, we're also going to have what's called pre-authorizations. So all I'm trying to do is compare these two insurance options for you because you're going to have to decide how you want to be covered. So if you're on a Advantage plan, about 72% of the services today that you're going to need for health care are going to have to be pre-approved, pre-authorized by the insurance company. So your doctor says you need a knee replacement or a hip replacement or an MRI or a skilled nursing stay. Well, doctor makes a recommendation, but that insurance company has to agree and has to approve it before they're going to pay for it. And sometimes they approve them immediately. Sometimes they delay approval. Sometimes they flat deny them. And so you're not going to get that knee replacement. They may say, go to therapy instead, get injections instead. You want a full hip replacement? Doc says you need it. They may say, no, we'll pay for a rod, and that's it. Okay, so you got to live with that. And so that's one of the issues with Advantage plans. So as we talk about insurance, you got to live with pre-authorizations. In addition to that, what's going to happen is permanent. Here's what happens. When you buy a supplemental plan, it is written for life. They can never cancel that policy because of age, because of claims, because you move from Dallas to Denver. Take it with you. It's a portable lifetime plan. Well, when it comes to Advantage plans, what happens with them is if you're on an Advantage plan for, let's say, 2, 3, 4, 5 years, any period of time, and you want to get off of that Advantage plan and go over into the supplemental plan, what happens is now you have to go through underwriting. When you first go on Medicare, you can have a supplemental plan. They have to approve you. Those companies do. Any plan, any company offered in your area, you will get the policy. Over here, if I start with that Advantage plan, I'm on it for any length of period of time. If I get off of it and I want to go over here, now I have to go through underwriting. So if my health has changed while I'm on this plan, and I get AFib or diabetes and I'm having complications, or maybe spinal stenosis, or some issue that's fairly major, and you're on the Advantage plan and want to get over here, now that a supplemental company doesn't have to take you. They're not obligated to do so. And there's 4 states that they are: New York, Connecticut, Massachusetts, and Maine. But if you don't live in one of those 4 states, you will not be able to get off your Advantage plan. A lot of people are not aware of that, but you have to know that that could be a permanent plan for you. It doesn't mean you have bad insurance. It just means now you're going to pay as you go, and you're going to be involved in networks. You're going to have to live with pre-authorizations, because that's the way that system works. Okay, so when you go on Medicare, you're going to have to decide which one of these insurance options you would like to use. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. All right, let's wrap this up by talking about getting help. First off, I want you to know there are very few people that can do this successfully by themselves. Okay, now I'm not saying you're not smart enough to do it, but it's usually your first time. Sometimes people get help from others that are in Medicare, and they get bad advice. I've seen bad advice coming from HR departments. Very sad situations when that happens. And I mean, there's a lot of confusing aspects to Medicare, and unless you know how to connect every dot, put all the pieces of the puzzle together, you're very likely to make some kind of mistake. Again, you're smart enough to figure it out, but there's just a lot of information, and sometimes a lot of misinformation. So the point is, most people are going to reach out to someone for help. And by the way, if you do it yourself, you can't save yourself any money, because when you get insurance, an agent has to write it. Even if you did that online, an agent has to process that, because those are the state laws. And so you cannot save any money by doing it yourself. And so if you reach out to help, you basically have 2 options. You can use what we call a captive agent, and this would be an employee of a large insurance company, whether that's Aetna, United Healthcare, Mutual of Omaha, Cigna, Humana. They all have their captive agents. In other words, they have agents who work for them exclusively. Now, by the way, it doesn't mean that they're bad people, but the problem with this issue here is you don't have a lot of options. In other words, they're all going to tell you that they have the latest and greatest plan that's available. Well, they don't. That's not possible. But they're captive, so they only get paid if you buy a plan from them. And again, not bad people, just limited options. And that's why us and others like us have chosen the other channel to be able to be in the Medicare business, and that is this. We are independent brokers, okay? Independent brokers have lots of options. Why? Because we write for not every carrier, but for most of the major carriers. We're going to write for them. So what we're going to do is we're going to compare all those plans side by side. We're going to look at the initial premiums of each of the companies, the stability of the rates of each of those companies. If we go to the Advantage plan, we're going to compare all those plans to make sure that you're going to be in the right network, that your medications are covered well. So in other words, we're going to look at all the details of your situation. This up here, they're just trying to push their company's plan. Here, we work for the client. We're going to make sure that we're matching up what that client's needs are with the very best plan that's possible for them that's in their market. So that's the way independent brokers work. Now, keep in mind, no matter who you work with, the agent's going to be paid by the insurance company. You never have to pay us. So truly, no matter who you go, there's no cost for services here or here whatsoever. The difference is here, lots of options, and hopefully someone who really knows what they're doing. Now, I do want to say this. If you choose to work with us, it'd be our privilege to help you. We are a full A to Z company. In other words, we'll help you with everything you need. If you need us to help you with your Medicare A and B enrollment, start Social Security at the same time. Sometimes people want to do that. We actually can do all that for you. In addition to that, we'll look at all the Advantage plan options, the networks, the medications covered by those plans, all the perks that are offered, and we'll also look at supplemental plans if that's the direction you want to go, and compare those plans and compare those premiums and stability of those rates. In other words, we'll do all of that for you. We'll take care of all the enrollment, truly at no cost to you. And then I'll close with this. Here's one thing that's very distinctly different about our company. We have our own customer service team right here in America. Sad to say, most customer service today is being farmed out. International call centers could go to China, could go to India, could go to the Philippines, and on. And so the point is, sometimes you call those call centers, and those people mean well, but a lot of times I can't understand them. And sometimes I don't even think they really understand Medicare. And so unfortunately, we got to work through some some of those call centers to help our clients resolve problems. But again, what's happening is these companies are going to these call centers because I found out these people make about $100 a week setting these call centers. And yet these companies make billions of dollars. You have a problem, and now all of a sudden someone across the sea is going to take care of your problem. That's not the way we operate. We have our own customer service team. You call into a U.S.-based customer service team, and number one, you're going to understand us. We all speak English. It is our primary language. And secondly, we understand Medicare, and we're going to take care of your problem. All right? And so that's something that we do. But we'd be thrilled to help you. Again, no matter who you use, there's no cost to you whatsoever. You just have to decide which direction you want to go.